Yeah, boy.
Here's 10 facts about deer ticks. Number 1. Deer ticks are smaller than dog ticks. Learn how to identify a deer tick and differentiate it from a dog tick. Number 2. Only adult females and nymphs can transmit infections through their bite. Male ticks attach, but they don't feed or become engorged. Adult females have red and brown bodies and are larger than males. Nymphs can be actively feeding between early April and early August. Number 3. Not all deer ticks are infected with the Lyme disease agent. Only ticks that have fed on infected mammals, usually white-footed mice, are infected. About 50% of deer ticks are infected with Lyme disease. Number 4. Deer ticks are slow eaters. Deer ticks live 2 to 3 years, and in that time usually enjoy 3 blood meals. In the spring and summer of its second year, a nymph will take its second meal. They insert their mouthparts into the skin much like a corkscrew, which ensures them a nice tight grasp. They often take up to 5 days to complete their meal. Number 5. It takes 24 to 48 hours to transmit Lyme disease. This fact is key to reducing panic when finding an attached tick. An infected tick must be attached to its host for at least 24 hours, and up to 48 hours to transmit the disease. It's also the reason why checking your body right away after every possible exposure to a tick-infested environment is vital. Number 6. Deer ticks don't jump, hop, swim or fly. Deer ticks crawl. They usually grab onto people or animals that brush up against plants near ground level, and then they crawl upwards to find a quiet place for their blood meal. Although many sources will state that ticks don't land on you from an overhanging tree branch, I have several friends who insist this has happened to them. Number 7. Ticks live in wooded, brushy areas that provide food and cover for mice, deer and other mammals. The ideal tick environment is humid. Your exposure will be greatest along trails in the woods and fringe areas between woods and the border, where they will wait patiently on the tips of vegetation for an unsuspecting host to walk by. Number 8. If you spot a deer tick on you, don't panic. Although about 50% of deer ticks are infected with Lyme disease, since the deer tick must feed for over 36 hours before transmission of the spirochete, the risk of acquiring Lyme disease from an observed tick bite is less than 2%, even in an area where the disease is common. Number 9. Use fine-point tweezers to get a hold of the tick as close to the skin surface as possible. Pull backwards gently but firmly, using an even, steady pressure. Do your best not to jerk or twist. Don't squeeze, crush, or puncture the tick's body. The fluids inside may contain infection-causing organisms. After removing the tick, wash the skin and your hands thoroughly with soap and water. If any mouth parts of the tick remain in the skin, leave them alone. They will be expelled on their own. It may take weeks. Trying to remove these parts will only cause unnecessary pain and skin trauma. And number 10. Throw clothing in the dryer. In a typical house environment, unfed deer ticks aren't likely to survive 24 hours. Because they like high humidity, ticks on moist clothing in a hamper can survive 2 to 3 days. Ticks that have taken a blood meal may survive a bit longer. If you know you've been in a tick-infested area, before throwing your clothing in the hamper or washing machine, toss them in the dryer on high heat for 10 minutes. That will kill the little devils.
Yeah, boy.